Go.
Hand hygiene.
Come in.
Gonna close the door for patient privacy. Hello, my name is Vicky. I'm a UBCO nursing student, and today I'm just gonna do a head-to-toe assessment on you. Is that okay with you?
Yeah.
Okay. And before we start, is there any discomfort or anything that you would like to address?
My right arm has been hurting a bit.
Oh, okay. Out of 1 to 10, how would you rate the pain?
2 or 3.
2 or 3. And is there anything you've been noticing that's been making the pain feel a little better?
If I don't sleep on it, it helps.
Okay. And anything that makes it particularly worse?
No.
No? Okay. And how would you describe the pain? Is it like a sharp
Sort of
pain?
like a stabbing or
A
sharp
stabbing?
pain. Yeah.
Okay. And does that pain radiate to anywhere else of the body?
No.
No? Okay. I'll definitely make a note of that. But how did you sleep last night?
Good.
Good? Okay, that's good. So, before we start, could I also get your first and last name, please?
Avery McCluskey.
Perfect. And Avery, do you know where we are right now?
Yeah, the hospital.
Okay. And do you know the time by any chance?
12:30.
Okay, perfect. Avery, have you been experiencing any dizziness or headaches at all?
No.
No? Any blurry vision?
Mm-mm.
Okay. And do you have any concerns of the mouth, like dry mouth, or the throat?
No.
Like a sore throat?
No.
No? Okay. So Avery, I'm just going to assess your lungs first.
Mm-hmm.
Can I put my hands on the front and the back of your chest there?
Yep.
Okay. And is it okay if I remove the gown?
Mm-hmm.
So I will be just putting my hands here to check color, temperature, and see if it's distended. Everything looks good. Alright, Avery, I just have a couple more questions for you. Do you feel like when you're moving around or at rest, do you feel a shortness of breath at all?
Mm-mm.
Do you feel like you have any difficulties breathing?
No.
Okay, and do you have a cough?
Yes.
And is that persistent or?
Yeah. Persistent.
Yeah, okay. When you cough, do you find like mucus or anything that comes out of your
Yeah, a
cough?
little bit.
Do you think you can describe that for me a little?
It's yellow color.
Yellow, okay.
Mm.
I'm just gonna listen to a few places on your chest for your lungs, okay?
Mm.
Again, am I able to remove your gown there? Okay. Alright. So I will start with the upper, and every time you feel my stethoscope, just give me a deep breath in and out, okay? And I'm just gonna go under your chest there. And now the lower. Perfect. And now you can just read normally for me. I'm just gonna listen to one more point on your chest there, okay? I'm gonna go on the left side and go to the third intercostal space to listen to the herbs point. Perfect. The pulse sounds regular and there's no murmurs that I hear. Everything sounds good. Perfect. And Avery, do you think you can sit up for me? I just gotta listen to the back of your chin. Perfect. And can I move the gown as well? Okay. And again, every time I move my stethoscope, just give me a deep breath in and out. Perfect. Okay. Everything sounds good. No wheezing, no crackles. Alright. And now I'm just gonna check your stomach. But before then, I'm also gonna just ask you a few more questions. Do you feel any bloating at all?
No.
Okay. And how is your appetite recently?
Normal.
Normal? Okay. And how have you been eating? How much have you been eating?
Same as like my normal amount.
Okay. And drinking?
Same.
Same?
Yeah.
Okay, that's good. And when you eat or drink, do you find it difficult to swallow at all?
No.
Okay. And when was the last time you had a bowel movement?
last night.
Last night, okay. And was that normal to what it's usually like?
Yeah, pretty normal.
And would you say it's hard or soft?
Hard.
Hard, okay. And when was the last time you peed?
This morning.
This morning. And would you say the amount is kind of like regular as well?
Yeah.
Okay. And did it hurt, or is there any burning, any sensations when you pee?
No.
Okay. And is there any concerns about your genital area at all? Any rashes, any pain?
No.
No? Okay, that's good. Alright. Do you get any heartburn or nausea at all when you eat?
No.
No? Okay. So Avery, I'm just gonna move your gown again if that's okay, and I'm gonna listen to a few places on your stomach. Alright. So I'm first starting right lower quadrant, right upper. Sounds good. And now I'm just going to gently press on those areas as well. Is that okay with you? Okay. And do you feel any pain when I do that?
No.
Okay, perfect. Here, I'll put your gown back on as well. Alright. Avery, do you feel any tingliness, numbness, or you feel like you don't have strength on your hands at all?
No.
Okay. Can I grab one of your hands here? Okay. So I'm just going to check for capillary refills. I'm going to press 2, 3. So it's about 3 seconds. And then I'll compare it to the other side. 1, 2, 3. Perfect. Avery, I'm just going to flip your arm over here. So now I'm going to listen to her pulse. Just repeat that. Can I grab your other hand there?
Mm-hmm.
Just gonna compare it to the other side. The pulses seem equal. The pulses are strong. Rhythm is good. Perfect. All right, Avery, do you think you can just squeeze on my fingers like this with your hands? As hard as you can. Perfect. All right, looks good. And Avery, do you feel any tingliness, numbness, or lack of strength on your legs or feet at all?
Mm-mm. Do
Do you feel like there's swelling on your ankles?
No.
No? Okay. Is it okay if I move the blanket here
Yeah.
and assess your legs? Okay. Alright, so I'm going to first check for edema. So I'm going to, is it okay if I squeeze your ankles there? I'm going to squeeze her ankles for 5 seconds. 3, 4, 5. Perfect. So there's no edema. And I'm just going to squeeze on your big toe really quickly, okay? So because she has polish, I'm going to check for a cap refill on the back here. So that's 1 second. Compare it 1 second. Perfect. And now I'm going to listen to a few pulses. So I'm going to listen to the pulse right here, posterior tibialis. Should be there. Perfect. And then the dorsalis pedis, which is right here. Perfect, nice and strong. Everything sounds good. And Avery, can you just push on my feet or hands as hard as you can? Perfect. And can you put your toes back so it's pointing to your nose? Perfect, that looks good. I'm gonna put the blanket back on you. All right, the assessment is done. Is there anything of concern that you would like to talk about? And do you need to go to the washroom at all before I go?
No, I think I'm good.
Okay, and is there anything I can get for you to make your stay a little bit more comfortable? Okay, and the call bell is just on your side right there, so feel free to call whenever you need anything. It was really nice meeting you.
Nice to meet you.
Thank you. We'll close the door. Hand hygiene again. And we're done.
Yeah.